Welcome to Inside Healthcare, Dr. Kristi Trussell. Glad to have you with us.
Thanks for having me.
We have, it seems right now we have a threat of viruses, and I don't know that they're all hitting at once or whatever, but we're seeing the flu, COVID, and RSV. So what are you currently seeing at the urgency room?
Well, we're seeing lots of viral illness, lots of cough, colds, and congestion. All of the viruses that you mentioned are now seasonal viruses where we kind of expect things to be quieter in the summer. Not that you can't get a summer cold, we still see that too, but we do see more viral cough and cold illness in the months of September through midwinter, and we're seeing that usual uptick in our fall viral illnesses.
I've been hearing from a number of colleagues and friends and stuff saying how, well, they feel like they have this lingering cold or something. And I know I had one who said that she thought maybe she had COVID and she tested negative for that. And it turned out she had RSV. So how can you tell the difference between these viruses? Are the symptoms that much different or?
Well, so all of the viruses that you've mentioned can cause respiratory symptoms. So stuffy nose, cough, sore throat, chest congestion. There's not an easy way to tell simply by symptoms which virus it is. We are able now to test with rapid testing for COVID, flu, RSV. For the majority of folks, it's not going to change a lot of treatment. For folks who are very young or elderly, sometimes there are changes in treatment that would be beneficial. So therefore, if you're feeling under the weather, it's worth it to be evaluated. But the main symptoms of all these viruses do overlap quite a bit.
So it's probably best to be tested if you have any concerns. Or how would you be treating them then if you don't know exactly which virus you have?
Well, for the majority of viral infections, the main thing is supportive care. So using Tylenol for fever control, making sure you're getting plenty of rest, plenty of liquids. For those who have other health concerns or comorbid conditions, there are some changes in treatment. So if you have some underlying medical trouble or high-risk conditions, you may qualify for medications like Tamiflu for influenza, which prevents progression to severe illness, or Paxlovid for COVID, which also prevents severe illness requiring hospitalization. For folks who don't have underlying or complicating medical conditions, a lot of the treatments are the same. It's supportive care, and then preventing the spread of infection with good hand washing, staying away from others when you're ill, and staying home when you're sick.
And what are we currently seeing happening with COVID specifically? We thought we'd be past this by now at this point.
Yeah, I think as a healthcare community, we've kind of come to know that COVID is here to stay, and will continue to cycle through peaks and valleys of infection. I think we're kind of seeing a little bit more than we had been with the fall respiratory season.
Yeah, people maybe run down and things like that. Also, it seems like RSV, we usually hear that more toward later in the January or December and things like that, and we're already starting to see cases now as well. And are they affecting children or adults or both?
So anyone can get RSV. We tend to pay more attention to RSV, particularly in very young children. Those under 5 are at higher risk for severe infection and respiratory complications, but particularly babies we worry about. Those 2 and under, and then particularly babies less than a year. They tend to have just a lot more congestion, a lot more chest congestion, and difficulty breathing that comes with that. And there's a good number of babies who do require hospitalization for RSV every year. RSV is a seasonal infection. It typically in the United States runs seasonality runs from September through midwinter, kind of depending on where you are in the country.
And when should you take your child to see the pediatrician or for emergency care like yourself at the urgency room?
Yes. So, general guidance is that if your child is having difficulty breathing, seems really lethargic and isn't able to interact with you the way that you would expect, they're not drinking fluids well. Those are kind of the big red flags that they need to be seen right away. Otherwise, the recommendations for when to bring your child in vary a little bit by age. Any infant younger than 3 months with fever needs to be seen very promptly. Um, older children, it's based on symptoms. If you're, certainly if they're having difficulty breathing, difficulty drinking fluids, or don't seem to be interacting appropriately, that's a reason to be seen right away.
And probably still not a bad idea to get vaccinated against when and all of these, if you can.
So the CDC has updated vaccination recommendations for all of these viruses. They're still we still recommending seasonal flu vaccine. There's new RSV vaccination available for select groups. And there's a couple of different varieties of that vaccine. So if you have very young child, are pregnant, or over the age 60, we'd recommend talking with your doctor about RSV vaccination to prevent serious complications. And there is updated new COVID vaccine available as well.
Any other advice you'd be giving to our viewers on how to prevent or protect themselves during these respiratory viruses?
So, we kind of go back to the same good advice of good hand washing, covering coughs and colds, and staying home when you're sick. Those are the main things to prevent spread of infection.
Especially coming up into the holidays and stuff, we're maybe gathering and things like that. So any other final advice for our viewers?
Well, we'd be happy to see you at the urgency room if you have any acute illness or questions about how to care for yourself.
All right. Well, again, Dr. Kristi Trussell, thank you for being on Inside Healthcare. Thank you.
Thank you.
Where did the time go? Somehow I lost all those years. Where did the time go? I don't know how I got here. Oh, how did I get here? I can see now.
You've done the hard part. You quit smoking. Now do the easy part and get scanned for lung cancer. If you smoked, you may still be at risk, but early detection could save your life. Talk to your doctor and learn more at savedbythescan.org.
Well, welcome back to Inside Healthcare, Dr. Kristi Trussell. Thank you for being with us.
Thanks for having me this morning.
We have the holidays coming up, and then we have an increased number of possible things that could pose a threat to your health and thing. And one of the things I've heard about is a holiday heart. What exactly is that?
Yeah, so holiday heart is a nickname for a condition called atrial fibrillation, which is an abnormal heart rhythm that comes on after overindulgence in alcohol. And we do see that more around the holidays, hence the nickname.
And what would be the symptoms, and when should you seek emergency care then?
Yeah, atrial fibrillation is a heart condition, an abnormal heart rhythm And when people have atrial fibrillation, some people don't have any symptoms at all. Often, when it's more acute in onset, patients will have palpitations, which is the sensation that the heart is beating irregularly, or the sensation that the heart is racing. Some patients also have some chest tightness or some shortness of breath, particularly with exertion. That's something that we would certainly want to check out right away, and that's something that we regularly evaluate at the urgency room.
Yeah, you would think the chest pains, but not that some are rapid heart rate and things like that. There are things that, and it could be women, men, ages, it doesn't really matter.
Oh, so holiday heart can affect anyone, even younger people who overindulge in alcohol. We see this abnormal heart rhythm, and it can, like I said, it can happen at any age, young or old.
So any type of symptoms like that, make sure that they seek care and take it as an emergency then, right?
We always take chest symptoms, chest pain, shortness of breath, irregular heart rhythm, very seriously, and we recommend being seen promptly for that.
So during the holidays, what would be some of the other things that could pose a threat to our health during this time?
Yeah, so kind of jumping on from the holiday heart, we sometimes see patients with underlying or more chronic heart conditions, or such as congestive heart failure, that have exacerbation of their symptoms around the holiday related to overindulgence in salty or salty foods, alcohol. Because in the congestive heart failure, the heart has a real hard time pumping fluid forward, and overindulgence in salty foods or alcohol keeps extra fluid in the body and can exacerbate the congestive heart failure symptoms. So that's something we commonly see around the holidays too.
And maybe someone with other underlying things like diabetes or undiagnosed diabetes condition as well. Same kind of thing.
Well, diabetes, there's a couple of different types of diabetes, but certainly if there's dietary indiscretion or patients aren't taking their medications well, blood sugar troubles can be exacerbated by heavy meals or holiday treats.
We also hear around this time, it seems like that we always hear about a number of a house fire or even a fire death and things like that. What advice do you give to people out there to stay safe during these holidays?
So we'd recommend, so there's good recommendations out there for how to outfit your house with proper smoke detectors, proper carbon monoxide detectors. And those things are really important to make sure they're working well, have the appropriate batteries, and are tested regularly. One thing around the holidays is a lot of people have the gas fireplaces. And if you have small children or visiting small children, one thing that we do see is burns from particularly children, but anyone touching the glass on the outside of that fireplace. So having the protective screens and all the protective equipment on and in good working order, particularly if you're having visiting children, you can get pretty severe burns from touching that glass on the front of the fireplace.
And also around the kitchen too. It seems like there's a lot of cooking and things like that can also cause problems as well.
Making sure you're taking care in the kitchen, and then for things like crock pots and making sure cords are tucked back and not accessible to be pulled down or tipped over. Spilling that crock pot over can really cause some severe burns.
Talking about smoke detectors, it reminded me last Thanksgiving that all of a sudden our alarm was going on. Oh my God, what's going on? And we had a candle that apparently was close enough that it triggered it. And it was such this alarm. And it's like, so a great wake up to us at that time, blow out those candles and make sure that they're not close to anything that can cause a fire and stuff like that. Any other advice that you would give to families and for keep their kids safe and their family safe during these holidays?
Just if you're visiting a different house or setting, just kind of taking a look around and making sure that there aren't that there aren't any obvious hazards out and about before letting the kids loose to play. Things that the fireplaces, crock pots in the kitchen, making sure that, like you said, candles are out of reach and well tended.
And if they have any urgency room is with physicians like you that can help any condition that they have and stuff.
We have emergency physicians available to evaluate any new injuries. We'd be happy to see you at any of our 3 locations.
Well, again, Dr. Kristi Trussell, thank you for being on Inside Healthcare. We really appreciate it. Thank you.
Thank you.
Mom, seriously, why don't you ever listen to me?
It's hard to always know what's going on with your kids.
Hey, bud. How was school today?
Fine. Lots of homework.
If they're moody and closed off, is it just typical behavior or something more? The Talk They Hear You mobile app and Screen for Success tool can help you find out. The mobile app shows you how to turn everyday situations into opportunities to talk with your kids about alcohol and other drugs. And Screen for Success helps you find out if your child needs more support. Screen for Success gives you a better understanding of your child's health, wellness, and well-being, a confidential report of their screening results, and helpful resources. So download the free Talk They Hear You mobile app and start using Screen for Success today. Connect with your kids and help keep them safe and healthy. Because when you talk, they hear you.
The Supplemental Security Income Program provides monthly payments to help meet basic needs, like putting food on the table, paying the rent, or buying new shoes for growing feet. You may qualify if your income and financial resources are low and you are 65 or older, or an adult or child with a disability or who is blind. Call 1-800-772-1213 or go to ssa.gov/SSI to start to apply. Produced at U.S. taxpayer expense.
Well, welcome back to Inside Healthcare, Merri. Glad to have you back with us.
Great to be with you. Thanks, as always, Jody. Thank you.
And last time you were on, we were talking about the latest Minnesota student survey and some of the results of it. And since then now, I've learned that school and public health officials and stuff have even gone a deeper dive into what some of the stats and information. I mean, some of them are very shocking and alarming about mental health and well-being. It's deteriorated since the previous one, and especially for girls and stuff like that. So as a parent coach, maybe you can kind of talk a little bit. We can't go into all of the details, but just briefly, what are some of those things that parents should be aware of, what the students are experiencing now in our schools? And this specifically was Washington County Public Health.
Yeah, Jody, I love this quote that I recently came across, and it's that if we want to know how well our kids are doing, we just need to look at their parents. And you just let that sit for a second and you're like, oh my gosh, all of us are struggling. All of us are searching for that belonging. Where's my circle of care? Where's my circle to have the support I need? So I love that schools are really open and having these conversations about our children's well-being.
Absolutely, for really important, and then the schools are trying to respond to that as well, and trying to make sure better care of our students and stuff. But that is some of the things that came out on the survey about the families and the parents and how important the family role is in all of this.
Yeah, and I think a parent's role also is helping guide your kiddo to have that one person in their education setting that's their go-to. Home environment, what I try really hard to coach my clients is that's their safe space. We already have so many pressures coming at our kids every day that let's find home as the safe place. But who's your person at school? When that weight, that pressure, because there's pressure of grades, right? There's pressures to fit in. There's pressures, competitions of sports and athletics and boy, you name it, right? Theater, music, everything has that additional layer of competition. But who is that one person at school, kiddo, that you can go to as your your guide, your compass, your connection. And then parents' part when they come home is we want to encourage parents to have conversations that have nothing to do with achievement. When your kiddo walks in the door, how about we talk about, what did you have for lunch today? I might be super nervous because I knew my kiddo studied and studied and studied for that chemistry test, that math test, that spelling test, whatever the test is. And I might be like, I can't wait to see my kiddo because I want to know how that test went. But what if we remove that quote unquote achievement and we talk about, tell me about lunch today. I'm going to get at what really is circulating in my kiddos' emotions. Side story, when I was a kid, I grew up on a dairy farm. And the dairy farm, we had to ride I think it was like a 45-minute bus ride home from school because everybody in that area rode the same bus, right? And we get home and I have a super long driveway. And my mom would say, I could tell what kind of day you had just by how you walked up that driveway.
Ooh, that gave me goosebumps. Yeah.
Thank you. I mean, I want to be that parent for my own kiddos. I want to just put the screens away. And when my kiddo comes in, I want to just show up with love. I want to create that environment where my kids feel, I love the words from Dan Siegel, safe, seen, soothed, and secure. Am I creating that home environment that is just loving my kid for who they are, helping them love themselves too in their own skin? Or am I adding to those pressures?
And how does that simple thing of how they're doing, recognizing what they're doing, how does that help the student? How does that help the parents?
Oh, thank you, Jody. It helps us move past that. Now, I, as a parent, I have pressures too, right? Because I want to make sure my kid is perfectly dressed. I'm only putting out that perfect image family. Well, none of us are perfect. And it's being okay with being good enough. It's way more important to just show up, love your kiddo, help them have language around their emotions, help them know that here's some coping techniques, coping skills, so that when I really am frightened, I am really feeling that my fuse is going to pop, I know I can do these different activities that help bring my brain back into alignment. And if I'm practicing these at home, what a safe place to know, wow, I know mom's going to listen. I know dad's there for me. I know big brother is also right there. He's struggled and he's helped me support and walk through these things. I call out modeling, and so important when I, as a parent, have had a failure, to be open and not be afraid to say, I messed up. I got pulled over by a police officer today for speeding. Oh, and then literally say the self-talk so your kiddo knows, I need to do a redo. I need to forgive myself for that. I need to. And it helps your kiddo know that I'm not perfect as a parent. I don't expect you, kiddo, to be perfect, but I really want to help you show up and love who you are. I used to say, I want to help my kids love the skin they're in, because we all have gifts and I want to celebrate those gifts.
Always good advice here, Merri. So, and then on top of that, all of the other stresses and all of the other things going on, we have these holidays going on as well. And also shorter days, darker days. I mean, all of that can seem like that can be overwhelming for just about anybody.
Right. So then I talk to my clients, I remind them, how are you caring for yourself? And if they're like, I don't have time for self-care. I had one client one time say, Merri, that's a foreign word to me. So we move that up in the priorities in our coaching, because parents, we can't care for our kiddos if we can't pour from an empty cup. We've all heard that saying, right? Put on your own oxygen mask first when you're flying. So how are we truly stepping into that, setting an intention for the day? I just want to literally put your hand on your heart and say, good morning, Merri. I love you. And if we can start our day loving ourselves, wow, just think of the care that that message is bringing to anyone that we get to be blessed to be hanging out with.
You have some tools and some resources that you offer advice to parents. I know you also offer some really good educational programs as well. What were some of those things that you would like to share with our viewers?
Yeah, so I would love for people to join me I have a private Facebook village, I call it, where you can jump in, and that's our online support group, because we need to make that circle bigger. Who is in your circle of care, parents, right? Jody, you've heard me say before, all kiddos need 5 caring adults to become caring, responsible citizens themselves as they mature. Who's in that parent village? Who is there for you? Because we can't do it alone. So that I would invite anyone to join me there. I'm offering some free classes here in December. They're virtual. You can jump in at any time. Again, follow me. It's all on my social media pages, MKG Parent Coach, if you want to jump my website. Same for Instagram, and LinkedIn is my name, Merri Guggisberg. One more, Facebook. I have all of those different socials, and I'd welcome you. Join me, because it is that opportunity to talk about what are my kiddos' gifts and how am I celebrating those that really bring holiday harmony. It's going to ripple beyond, but let's start with talking about the holidays.
Well, as always, I love all of that good advice and stuff. Final comments that you might have for our viewers going into the holidays, going into this time of the year, and with everything else. Yeah.
I would say give yourself permission to take the pause, to be okay with, I don't have to attend every social thing. I can slow down and truly enjoy this holiday season with the people in my own bubble. I don't have to be at everything. It's okay to just love the ones that are right there in your own roof and make those memories. The other thing I would say is practice just being together, being okay with good enough, because none of us are perfect. Let's just be okay with, I'm just going to show up and be here. Gosh, I could name all kinds, helping people explore their emotions so that we can name it to tame it. So that then when I do have that nervousness coming up, I have those skills. I have tons of those on my website, also on my social, and you can always jump in a call. I will love to celebrate with you, and then also listen and help strategize when it does get bumpy.
Well, Merri, a pleasure as always to have you on Inside Healthcare, and have a wonderful holiday and a beginning new year as well. So thank you.
Thanks, Jody.